This is a Second Opinion. We're the sports medicine podcast. I'm Dr. Dhokal.
I'm Dr. Glass.
Dr. Destin, how are you?
Good morning, brother. Yeah, early morning, November 1st, right? Day after Halloween.
Happy? Yeah, happy November, dude. New month. And man, happy to talk to you. We had a good week of football this last week.
Yeah, it was exciting. Me and my dad's we do DraftKings together, and my daughter's got a little separate 50-50 type drawing that we do for a fundraiser for the team. And me and my dad kind of team up on that, and we actually had a pretty good weekend. We got a little money. I lost to my buddy in DraftKings, but I still got some money. A third place finish, but lost by 4 points. All I needed was our running backs to basically fall 4 yards, and we would have, but we couldn't get it done. But anyways, it was fun to watch. And then we were in the 50-50. I just needed my Raiders to win, and they did not do it, so we didn't win our 50-50. But it was fun. It was exciting. So
that's a tough one. That's a
Yeah.
tough one when you're counting on the Raiders to come up with a victory this season. It's been tough.
Yeah. So
they lost to the Lions, which we'll get to here in a few minutes. Since you're talking about picking, I thought I'd share a quick little story for you. I'm in this pick'em league where you pick the winner, no spread, and a few weeks ago, I don't know, I think I picked like 12 out of the 16 games correctly or something. So I won out of our 40 people. And a week later, it was average. And then this last week, I'm almost embarrassed to say, out of the 16 teams, I picked one correct. You can't even try to get everything wrong.
I was just going to say that's even almost harder, right?
That's what I said. I said I feel like I should win a little something just for being the lowest scorer ever in the history. I don't think anyone's ever only picked one correct,
right,
in our whole league in years and years, but I managed to do it. So I was a little disappointed I didn't go totally over,
Right. Well, the disappointing thing about that is you put 3 hours into picking those, and then you come up with it's the energy. The return on investment was not good for you.
Right. Well, luckily it was just a few minutes, but yeah, it was humbling for sure. The guy who's supposed to know a little something about football, like completely, like flip of the coin would have been better, Man, I'm excited to talk about a couple things with you. Our topic of the week this week is tennis elbow, and ironically, after we had spoken about making that the topic of the week, I had somebody come in with some elbow issue, and he said to me, I have carpal tunnel syndrome. And I said, oh man, like, did you get diagnosed with that officially? I always like to ask people, are you, is that a self-diagnosis, a WebMD doctor, or is this like you went to your GP or somebody? And he went on to say, no, I went to my doctor, and he said, yeah, you have this inflammation. And so then I was like Googling it, and he's like, turns out I have carpal tunnel in my elbow. And I said, excuse me? And he goes, yeah, it's really bad. I have carpal tunnel in my elbow. And I said, let's rewind here real quick. And
it's so bad you're the first one ever to have that case.
Right. Yeah. I said, this is an emergency. So I said, no, normally that's, not in the elbow. And we kind of went through it. And I wasn't really sure if it was what they typically call golfer's elbow or tennis elbow. It turned out it was more tennis elbow, which is, lateral epicondylitis is how they, typically say that, versus the golfer's elbow, which is medial epicondylitis. And so I know you probably had a lot of those clients and situations, whether it's pitchers or young athletes. Who do you normally see walk in with that? Is that somebody who's older in your practice, Dustin, or someone who's an athlete?
I see it's kind of the spectrum. Typically, the younger athlete, 15 or younger, will come in with that. Specifically the inside elbow pain. And typically it's a pitcher or a thrower of some sort. That's their muscles are developing faster than their growth plates are developing. So we're seeing that muscle pull on that bone harder. So, and then the flip side is I'll see somebody in their 40s on typically get it. And typically that's on the lateral side. That's what I'm kind of seeing, is because they're, starting a new hobby or did a project out in the yard that took them, longer than normal. And now they got this pain on the outside of their elbow. And we'll get into the specifics of why, but those are the kind of the two cases I see most often.
It's interesting the mechanism of how people develop. I'll call it golfer's elbow from here on out. I'm sorry, tennis elbow from here on out.
Mhm.
A little easier to say than lateral epicondylitis.
Yeah.
But
So just real quick, tennis elbows on the outside, golfer's elbow would be on the inside, just for people, but we're gonna call it tennis or golfers. Little leaguer's elbow is also on the inside, so
mhm,
little leaguers and golfer's elbow would be the same mechanism.
yep.
How
No,
how many times do you come in and you tell people what they have and you use those names? I've never even golfed. How can I
right,
have that? Or I don't play tennis.
right.
So okay, pickleball elbow, whatever you want to call it.
Whatever you want to call it,
Yeah,
right.
yeah,
Yeah, no, that's what I was going to say. What's interesting is the many different ways that you can irritate that part of your body. How you can have tennis elbow and not ever have played tennis. And so, I've had a carpenter who does a lot of hammering, a lot of actually, screwing was his mechanism of irritation for that. And so it's always interesting to me how people develop it. That's one of the things that I like to find out, obviously, before we treat is what's causing it. That way we can modify or change up what they're doing. And so, yeah, it's not just, like you said, not just playing golf. It's not just playing tennis for the tennis elbow. It could be many mechanisms of injury. And typically it's irritation and inflammation of those tendons there.
yeah. Where
Uh,
those tendons attached to the bone of the long bone of the arm.
yes, correct.
Yeah.
When was the last case that you had that somebody presented with something like this?
Yeah, so I have a current one, kind of interesting. This would be somebody in between their 40s and 50s. Um, Kind of an interesting case because he came in with both, right? Like inside and outside, which a lot of
Mhm.
people think, no, it's either one or the other. I've seen it multiple, where you can have both sides and it comes with a little, okay, what's the history behind this? So for him, it was kind of an interesting case where he, um, he changed careers. He went from a desk job to then a more manual labor job. He took over a company where he had to be more hands-on, and
Mhm.
so he had this transition of going from type to now using his hands, like physical labor. Um, so then when we were talking about it, I said, "Oh, well, that's obvious. Then it's because you're changing up the mechanics of what you're doing. You're now using your hands, screwing, twisting, lifting, pulling, stuff like that." He said, "No, it started before I changed the work." I said, "Oh, okay, that's interesting. So
Mhm.
then what were you doing prior?" He's all nothing. And I said, "Well, it never just appears. Okay, so we got to work backwards. Let's go back 6 months. What changed in your life? Because everybody wants to go that week or that day. Okay, I didn't change anything." So we worked back, and one thing that he did start doing that was different was he started and he picked up boxing. So he had this mechanism of, the punching mechanism, which is a twist and jab, right? So he had repetition in there with contact, so his elbows started to feel it when he had not done that motion for a while. So that's a mechanism that can cause it too. um
For
so
sure.
so then he did that, started pounding his forearms, and then he started doing that work, and it just exacerbated. Now he's in this just protective mode where it's very hard to calm down because he can't avoid it. So
Mhm.
it's a challenging case for sure. I mean, we know how to treat it, we know what to do, and we're trying to keep it at bay, but it takes a lot. It takes a long time, especially it takes a long time if you just have one of them, but
Yeah,
having both of them, because it's multiple muscles pulling on those bones. So
that's a lot. Yeah. Most recently, I had a client come in. He had tennis elbow in both elbows. And so, you know, sometimes I wonder what's worse. Is it to have, tennis elbow in both elbows, or is it better to have lateral and medial in just one elbow? Like you said, it's
mm,
both sides, multiple tendons pulling on the same kind of general area, a lot of inflammation, irritation, and then like all movements cause pain, not just internal rotation or external rotation, perhaps, or impact or stress. It's like everything is irritating to that area. Um, the client I had come in most recently, it was from overuse. So a lot of working out. He was doing a challenge with his sons. Have you heard of the Murph,
yeah,
like the CrossFit
mhm,
Murph?
yeah, CrossFit.
Um,
I've
break
done
that
a
down exactly.
modified. I haven't done it, the full one. I've done a modified. It's brutal.
Okay.
but it's for a good cause. I mean,
Yeah, I have a lot of CrossFit athletes that come in, as I'm sure you do. There's a lot of CrossFits actually in close proximity to my office. Um, I haven't been an avid CrossFitter myself, and so I've heard these terms like the Murph, and I know it's to, you know, raise money, and it's in memory. But what is the actual? Is it like 100 pull-ups and run them a couple miles? Like, do you know what the?
I'd have to look it up. Yeah, give me 2 seconds. Keep talking.
Yeah, so
It's a good one.
this
Yeah.
patient, he, I think typically people will do that Murph workout once a year or, at a certain time. And he decided with his sons, he's, in his mid 40s, he has a college age son and a high school age son. And one of his two sons said, "Hey, let's do the Murph every day for 30 days."
Oh, geez.
And he said, "Let's do it." He said he kind of felt challenged by his son, and he said, "Yeah, let's." And he's in good shape. He's probably our age, Dustin, and
Mhm.
pretty good shape. And he said, they did it before, and it was no big deal, but the 30 days in a row of doing it really wrecked him. And so
Yeah.
I think he told me it was like 100 pull-ups a day, and they did that for 30 days. And I said, "Dude, that's
So here it is. You ready?
yeah, let's hear it."
It's 1 mile run. You start with a mile run,
Mhm.
and then you do 100 pull-ups,
Okay.
and then 200 push-ups, 300 squats, just body weight squats, air squats, and then you finish with the mile run. And then yeah.
Bro,
So
what?
yeah.
A
So
100 pull-ups, 300 squats, and 200 what did you say?
200 push-ups, 300 air squats, and then another
That-
mile run. So you're running, yeah, mile on either end of 100 pull-ups, 200 push-ups, 300 squats, and then run another mile. After those 300 squats, running that mile, the average time is around 45 minutes to that's if you're moving them pretty good. Most normal average people are not doing the 45. So the fastest I think I read was 34 minutes around that time range. That's moving, man.
Bro,
So doing it a day, every day.
which one of those wrecks you?
Me personally?
Yeah, yeah.
No, yeah, no. So I mean, I couldn't do the pull-ups I couldn't do. Yeah, I couldn't do the pull-ups at all. I could do the squats, it would take me forever. Yeah, and the push-ups I could chip away at, but I couldn't do the pull-ups. The body
Man,
weight would kill me.
I've
So
never I've never attempted that. I don't know if I realized that it was that aggressive. Yeah, dude.
that's
20
typically people do it once a year and they dread it. It's on typically on Memorial Day. It's a
yeah,
Memorial Day challenge, and typically, yeah, you don't look forward to it
yeah.
by design. It's a killer. So to do a challenge, a 30-day challenge, is nuts.
Man, there's something inside me that like just awakened, and I'm kind of like I'd like to make an attempt at that. I already know that the actually every one of those is going to be challenging. The 100 pull-ups is I'm going to be exhausted. The 200
Yeah,
push-ups I'm going to be exhausted. The 300 squats I'll be exhausted. The only thing that I won't be exhausted on is the first 1 mile run.
yeah, right. You're like, I'm good. I got this.
I'm good on that one. Yeah. Well,
Yeah.
that explains it. So he did the Murph every day for 30 days.
No way.
Came in, both elbows wrecked. Um, his presentation wasn't abnormal. He just was like, my elbows hurt. Luckily, we were able to diagnose that it wasn't carpal tunnel in his elbow
Yeah.
to start off. But so, yeah, inflammation, both elbows, like kind of in the soft tissue area of the lateral elbow. You have a little sulcus there. And that was point tender. And doing things like grip testing, rotation, resistance, all irritated that elbow. So very quickly, we were able to kind of correct it from a carpal tunnel, rule out golfer's elbow, and kind of rule in that it was more tennis elbow on both sides. And his thought was it was due to the pull-ups specifically. Would you say that that would be accurate, or do you think it was the push-ups and the pull-ups? It was a combination of everything. and
No,
the
I think it
volume.
was the pull-ups for sure, because you got the grip plus the flexion and the form. You're pulling through, and
Yeah.
so you're having to typically, especially the inside, it's coming from that flexion, those flexor
Mm.
tendons. So, yeah, I would put money on that.
Yeah, that makes sense. Treatment wise, with him, we did a few things. First, it was let's assess it. Let's figure out what's happening. Where is it point tender? How much inflammation is there? I did some soft tissue work on it. Um, we talked about some bracing and some stretching options post treatment. But what I did use on him was the ARP wave machine, and we ran some current to see kind of how he felt really. And after one session with that, he reported less sensation in his fingertips as far as kind of a numbness tingling that he was having and a little shooting pain. And upon flexion and extension, he felt less, um, how did he put it? Not irritation, ratchetiness. Like when he was flexing and extending his elbow, he felt like it was like catching, it was
Mhm.
very irritated and it didn't feel smooth to him. So after one session that helped. I'm going to see him again on Friday in a couple days, and so we'll see how he feels after that. Recommended to chill out on the pull-ups and anything that's going to irritate it, and keep his workouts lower extremity or core based. What besides taping, which I didn't do this time, I'd like to tape him the following time. What is your approach typically with that, Dustin?
Yeah, so anytime forearm issues come in, and real quick, so and just for the listeners, typically with any kind of tennis or golfers or little leaguers, you're not getting that numbness and tingling. So if he's having any kind of sensation or anybody's having any sensation in there, then we're thinking some kind of a nerve entrapment along those, that median nerve specifically, which is the carpal tunnel nerve, can be entrapped 9 different areas up the arm.
Mm-hmm.
So, but the carpal tunnel is the one that gets blamed. So there's a lot of times even orthos will tell somebody, hey, you have carpal tunnel, because they're having the sensation of that median nerve entrapment.
Mm-hmm.
And then they come in, we test it, and sure enough, it's not the carpal tunnel, but it's the where the flexor tendons cross and the
Right.
supinator and the pronator cross. It can be entrapped right there. So then we have to clear that out. You can do everything you want to the carpal tunnel, but it won't clear it out. That's because it's trapped and you just map it all the way up the arm. That saves a lot of time. So on that point, when somebody comes in, I always rule in or rule out all the muscles involved. So I have about a 10-point checklist I do. I
Mm-hmm.
muscle test about and it's not muscle testing like applied kinesiology, it's muscle testing like or resistance testing.
Right.
And I test all the muscles that affect above and below the elbow, and then we come up with a pattern and see which ones are affecting, because a lot of times, like with the flexor, the pronator will be involved, right? So with a golfer's elbow or little leaguer's elbow, you also have the pronator. So if we're just going at the flexors, which is what most therapy will go after, you come in with a golfer's elbow or a tennis elbow, they'll go after the extensors because it's the extensor tendon usually. But
Yeah.
it takes so long because you're forgetting to go after the supinator or the brachioradialis. So or on the inside, the flexor carpi ulnaris, so we map out every single one of those, and I go through a checklist and I test every single one of those muscles, and then I come up with a game plan based on that. And it's not just the extensor or the flexor, and then it starts clearing it out quicker. So that's how I kind of assess every single forearm, elbow, or wrist issue. I first do that, and I treat those. Typically, we'll do some cupping right away, get a lot of blood flow to once I've mapped out those muscles, regardless of where the pain is. Those muscles that were involved, I'll trigger point with cupping, and then I'll finish with active release or myofascial release. And then after that, home care, I'll send home with them taped. I also give them lengthening moves for all the different muscles that were involved, specifically just the ones we tested out, not just generic Googled
Right.
wrist stretches. They've already tried that, right? It hasn't worked. Now we give them a game plan specific on the exam that showed up, and that changes their mindset right off the bat because now they feel like, okay, now I have a specific thing to what I have, not just what the blanketed tennis or golfer's elbow says.
Yeah, yeah.
So, and then we work it up, and yeah, so one thing I saw for me, while I was doing a lot of CrossFit, I got tennis elbow, or at one point, doing one of the movements, and we had a cryotherapy right across the street from the gym, and I would go in and cryo, and we would do spot treatment with the spot cryo,
Mhm.
and that cleared out. I couldn't believe how fast it cleared out my tendinopathies.
Yeah.
So I'm a big, and I did that on a few patients. I would take them over, and actually the owner allowed me to treat my patients with it, and it really worked well. So I highly recommend anybody that's had it to seek out some cryotherapy and do the spot treatment a few times and see if that clears out that tendinopathy really quick.
So that
So
just accelerated the decrease of inflammation in that area. That was more effective for you than like putting an ice pack on. That spot cryotherapy was really an accelerant for you.
yeah, it's an accelerant, but it also is like a shock therapy, meaning not in the shock therapy that's out there, but in the
Yeah.
fact that the brain thinks you're freezing to death. And so after the threat is gone, it releases all the human growth hormone and all the mediators needed to actually repair as well. So it's not just like putting ice or doing ice cupping, it's getting it to that extreme and then taking off the extreme. So yeah, we're dropping the inflammation to help with the stability and the healing process, but they're also bringing in all those healing mediators, which is the difference.
Yeah.
So you're actually healing as well, not just dropping inflammation. So
It's creating a response, which is
mhm,
positive.
yes.
Yeah. No, I think that's well said. It's interesting with that client when I was saying he was having symptoms in his fingers. One of the things that I didn't explain to him upon reflection now is that, we cleared that out. What I had found was multiple trigger points in his flexors. And so in his forearm flexor muscles. And so we did a little bit of ART and a little bit of flexor release. He actually had some trigger points and a lot of bound extensor uh, tissue as well, right? So it was really like flexor and extensor, his whole forearm. I mean, imagine just doing 100 pull-ups a day for 30 days. His arms were just really locked up and tight. And so along with adjusting the elbow and doing the conservative treatment to the elbow, I did a little ART on the flexors and extensors. And I think that's really where that numbness tingling was coming from.
Mm.
And I failed to explain that to him. Sometimes you just get going and fixing the problem and not so much explaining where it was coming from. But that's a good point. I'm going to make sure to mention that to him when he comes in Friday is, hey, that's kind of two separate things going on related to the same area.
Yeah. Yeah. Perfect. Yeah. With little leaguer's elbow, we do see the tingling a little because it affects that ulnar nerve on
Mm-hmm.
that ulnar nerve gets trapped, over by that UCL that
Yeah.
we've talked about in the past. So sometimes where that nerve comes through. So we will see that on the inside fingers. But yeah, they're tough cases. I feel bad. They're kind of like a plantar fasciitis of the elbow, right?
Mm-hmm.
Not somebody's going to say, "Oh, the plantar fascia is not up there." You know what I mean? Like it
Yeah.
just you feel bad when somebody
It
comes in with
lingers.
it because it's a long road
Yeah.
because you can't necessarily stop gripping or twisting or doing things on a daily, right? So um that's the tough part about it. So I always recommend a compression sleeve
Mm-hmm.
or one of those braces that locks it up. And the way I explain, because a lot of people come in and say, "Oh, I've used those tennis elbow braces and it doesn't work." And I try to explain to them. I said, "Well, it's not going to eliminate your pain. The way they're meant to work is to
Like
the
angle.
insertion point." Yeah. So basically, and I always use the analogy. I say basically, if that muscle and tendon are pulling at 100 pounds of pressure off that bone, we want to change that angle. So we make a new attachment by putting that brace, which has a bubble or a little, pressure point on there. And now that's the new insertion. So instead of 100 pounds of pressure, now you got like 80 pounds of pressure or whatever it is, it's a made up number. But just to get the point across is that now instead of that constant 100 pounds of pressure, now you're only got an 80. So it's going to allow it to heal. You're still going to feel the pain. So once they understand, hey, it's not to totally eliminate the pain, it's to eliminate the pressure being pulled. So I heal faster in the back end. Then I think people are more compliant to wearing it. And
Yeah.
so it's huge on the education point to explain, because people just think it's for the pain relief, and it's
Not exactly.
hopefully we want it to help, help with the pain, but the reality is if you understand the mechanism behind those braces, then you can be more compliant and use it regularly, and whether you feel pain relief or not.
No, that's a good point. I like how you put that about it changing what did you say specifically? It was
Changing the attachment site. So we're
changing.
just bringing it down, below that area.
Yeah.
So
I use a different term. I don't know if it's accurate, but I'll run it by you, see what you say. I tell them that it adds another anchor point.
mhm,
So I'll say, like, if you think of a boat or a cruise ship docked on the dock, and there's one rope that's holding that too, you can visualize all of that weight of that cruise ship or boat is anchored down from that one rope onto the dock, for instance.
yeah.
And what we're doing is creating another anchor point, and so now all of that pressure or weight is now divided upon two anchor points versus one anchor point, and that's kind of what the brace does.
Yeah. I
um,
like that. No, that's good. That's a good analogy. I'll give you credit 3 times when I use it, but then I'm gonna take it as mine, okay?
that's fine, it's all
Yeah.
good. I don't even know if that's fully accurate. Sometimes I just have visualizations in
Yeah,
my head, and I just try to
me
help
too.
people
Yeah,
see it in their own mind.
yeah, me too. It makes sense. It helps it make sense, so
Yeah. uh, with the younger population, Dustin, you were saying with the little leaguers and stuff, I've been seeing a lot of, when I say younger, I'll say, 14, 15 and below, say maybe 8 to 14, in that age range. I'm seeing a lot more um, of this type of issue and injury where parents are bringing in kids. And my question to you, being a parent, is do you feel like it's things like you're throwing the curveball too young as a pitcher, or do you think it's more overuse, or do you think it's just the nature? When, I guess, rewinding a little bit, when I was younger, football season I played football, basketball season I played basketball, soccer season I played soccer, and so I was always changing it. My arm got a rest when I wasn't playing football, when I wasn't running track. There was some variance, and now I see a lot of specificity, a lot of specialization. And do you think it's the overuse where someone's playing, for their school and then playing in private leagues, and it becomes year round, right? So do you think it's that, or do you think it's just kids are lifting weights younger and getting
yeah.
stronger? What's your thought on that?
I think it's a couple of those things. I agree with you. It's, and in California and other places that are warm all year long, we see the constant play, right?
Mhm.
Other states that have seasons don't play typically all the way through. I'm not nowadays everybody's trying to compete with their neighbors, so everybody's doing it
Yeah.
across the nation, but and world. But yeah, there's no break time fully, and everybody's trying to start at an earlier age. Now we got to remember that especially with little leaguer's elbow or golfer's elbow, but little leaguer's elbow we're talking about, that osseous part where the attachment side is, the bony part or the
Mhm.
attachment side, that's the last part to ossify in that part in that arm, and it ossifies around 15 years old. So between 13 and 15 or whatever that age is, depending on the person. But that's the last spot that fully solidifies. So you add that in conjunction with forceful movements on a bony part that's still trying to heal. It's a recipe for having an issue. On top of that, yes, this is what I typically see is that it's not necessarily, it's typically the kid that is developing at an earlier age, right? You always see that the man child in the group, right? So and not across the board, but it's typically the kid that's a little stronger, a little bigger, that's now incorporating that curveball typically. And because they can grip it, they can feel it, they can do it. So they do. And the parents and coaches a lot of times encourage it because now they're a threat on the team because most kids in their division are just throwing fastballs or a
Right.
little slider or whatever. Now that you got this kid that physically can throw a curve, well, we're going to encourage it. They're going to monitor it because everybody knows nowadays you should not introduce that. But if you have that little advantage, you're going to say, okay, we'll throw it 10 times this game, right? Or
Yeah.
whatever it is, right?
Use it
So
as a strikeout pitch.
and yeah, so you're seeing this bigger kid with bigger muscles. So the muscles are growing at a faster rate than that bone can keep up with. And that's what's happening. The development doesn't match up because they're working out now, they're strengthening. So we're seeing that bone. Now you see the same age kid that is not developed as much, that's developing at a normal pace. They're not having these same issues, right?
Right.
Same age, same sport, but their bodies are proportionate, right? Not saying that the other kid's disproportionate, but the power and force he's putting into it. So that's what we're kind of seeing is that's kind of the demographic of who I'm seeing this happening to, not the kid that's perfect for his age and development. And I'm saying words that don't, I'm not saying that there's anything bad about the other kid. The other kid's just more advanced, right? So more advanced for his bones. The last thing I want to make a point, what I honestly think I see causing a lot of these issues, like you said, there's more of an issue, is it's not necessarily the sport. What do we do on a regular, consistent basis? We hold those phones. Okay. So these kids are holding phones more now over the last, 20 years or however long. And so we're seeing when you hold a phone, if you look at your hand, it's curled, it's flexed, right? So you do that most of the day and you're typing away, your fingers are flexed, you're using those little digits, and then you go ask those muscles that have been shortened all day long to now use a forceful motion. That's where I see more of the problem, not necessarily the little league. We've played forever, right? And it's it should be a random thing, not a regular thing.
Yeah.
But the consistency is coming where I think it's more of the outside stuff we're doing, a lot more typing, a lot more,
It's a great
so
point.
we got to find a balance. So I always talk to my kids about that come through. Is like, hey, I know the reality. You're not going to stop being on your phone, but you got to understand you got to take breaks and you got to do more care. If you're going to do that, you have to do something opposite to balance it out. If not, you're going to have these issues because your body just can't take so much.
No, you know what? That's a great point, Dustin. It's not always the hour of game participation or 2 hours a day, 10 hours a week of practice. If you're doing something 20 minutes at a time, 6 times a day, every day, like holding your phone, that'll create an issue. I had a younger, probably in her late 20s, early 30s, woman come in, thought it was carpal tunnel. And, to shorten the story, she holds her phone like a lot of us do, like this.
Yeah.
So it was pinky and wrist flexion.
Yeah.
And, turns out she's in bed like this a lot and holding her phone up. And so her wrist is cockeyed and she was having this issue in here and wrist pain. And she also is a computer person all day long. And so she's like, man, work's killing me. And I was like, I think your phone's killing you and making your work worse.
Right.
So that's something that I sometimes overlook. I'm glad you brought that up. It is really the things that we do every day.
It's a hard, sorry. It's a hard one for people to wrap their head around because what they'll say, well, that doesn't bother me to hold my phone. Right. I understand that. That's because you've trained your body and your muscles. That becomes the norm. So to your brain, it's normal because you're doing it on a regular. Or they're like, well, it's not hard to do. When you hold your phone like that, you're contracting muscles to hold that phone. So even though there's no motion, it's contraction. It's like holding a wall sit or a plank. That's what I tell my patients. I said, if I had you do a wall sit right now, you're not moving, you're not physically moving, but how long can you last before it starts to fatigue and cramp up, right? Well, not very long. Well, if you did that every day for 5 years, 10 years, you would get to the point where you can hold that all day long, just like your phone, right? So we see it a lot of times when the new iPhones come out or a new phone come out, you get the bigger ones. When the bigger one came out, everybody was coming in with this, and it was because they went from, well, it's the same motion, yeah, but now you have different weight, your hands are different. So it's anytime you change a pattern like that, we're going to see a difference. So
No, great point. Great point. Just to summarize on that, I think it's, a treatable condition. In my experience, it's taken some time. It's taken for some people up to 6 months or longer. I've had some patients that it's taken 9, 10 months to kind of resolve, but because their activities of daily living included irritating moves. So it wasn't like I'm just taking time to rest and nothing is going to aggravate it. It's like, well, I'm not aggravating it as much every day, but I still got to brush my teeth. I still have to type. I still have to drive. I still have to do all these things that can cause some irritation. Treatable. That's the takeaway on it. I think patience and change of activity and doing the conservative things that you mentioned are super important.
yeah,
I wouldn't leave it to resolve on its own. I would seek out, medical help or uh, professional attention from a physical therapist or a chiropractor or somebody, who is able to unwind that and kind of give you some home care tips.
yeah, yeah. And one thing I would say too is if it's not resolving and you've been to PTs and several PTs, massage therapy, I even had a recent case where, I got my ortho friend involved from one of the teams, and he agreed with me what it was. We both diagnosed it the same. So it was nice to have a couple of opinions on it, different eyes on it, an orthopedic side and a mechanical side.
Sure.
And we both agreed it was, tennis elbow. And so I said, okay, well, let's continue to treat. I referred her out after about 5 or 6 treatments where it was getting better, but it's still not right. Well, I said, you know what? After 3 more times of doing this, and it was getting better, but then get worse again, I said, let's work up the chain. So I went up to the shoulder, started getting the shoulder. I actually started the shoulder after about the 4th time, getting mobility back in the shoulder because her shoulder was really locked up. She was a hairdresser, or
Mm-hmm.
she's a hairdresser. So we started working on the mobility of that shoulder. That would help too. And then finally, I said, you know what? It's still lingering. So we started treating the neck. After the first time of treating the neck, elbow pain went completely away. And we're both like, holy crap, like, those are things we know, but you got to work through the chain, right? So the whole idea is like, don't give up on it, or don't stay on one thing. If you keep doing the same thing and you're not getting really lasting results, you might get temporary results for a couple of weeks, couple of months, but we should start seeing more drastic changes. And so that's why, so, it's just a good reminder to always go at the source of the area of the neck too,
Yeah.
um, to see. So
Yeah. Further down the chain, above and below. And I think the improvement, but not lasting improvement, is an important thing that you said,
mhm.
because sometimes you do get temporary improvement. It's like, well, it's coming back, and you think of, I call them pinch points. There's multiple issues. Like when somebody complains of carpal tunnel or something, that could be a pinch point in the wrist. It could be a pinch point in the elbow. It could be a pinch point in the shoulder, a pinch point in the neck, or you know what, maybe a little bit in multiple areas, right? And so I think what you said about going above and below and not just checking the actual specific irritated site, like sometimes there is something else that's happening up the chain or down the chain that contributes.
Yeah, perfect.
Um, well, I'm glad that we covered that topic because I know it bothers a lot of people, whether it's the athletic population or a working population, working professionals. But I want to switch gears to the NFL. Let's talk about what you saw as interesting this weekend. I know there was a couple of games that piqued my interest, but I thought I'd ask you first. Was there one particular game that you were watching because of interest in a player's injury or just as a fan?
Well, as a fan, following McCaffrey, I mean, he got his 17th straight, game with a touchdown, which is fun.
Amazing.
I've had the chance of meeting him and, on a personal side, and he's an awesome guy. And so I always like following, he's just a good human being too. And so I'm just happy for what he's doing.
That's cool.
So yeah, so that's exciting to see that happening. And so I watched that game, even though I don't like those bums, the Niners, but I like people. So
Yeah, it's tough
um,
to like it's tough to like a a rival, right?
Yeah, you know how that goes. So, especially when you got guys in different, cities and they move around and do different things. So, anyways, so that was fun. I'm really bummed about Cousins,
Yeah.
because I'm a big fan of his. I watched that quarterback series. I don't know if you saw that on Netflix, but the
Yeah.
quarterback series, they highlighted him quite a bit. He's just such a contrast to a lot of the different quarterbacks out there. Just a different style. I like old school style. He's an old school type quarterback, in my opinion. And plus he was getting chiropractic care in that documentary. So
Yeah.
I like that he has that in his repertoire of things, and he highlighted that. But he just seemed like a good person too. Not that the others didn't. I like their style of plays too.
Sure.
On that documentary. But he's Kirk Cousins kind of goes under the radar a lot. So, anyways, I've been rooting for him. I mean, he goes under the radar, but he shouldn't, because I mean, he's out there. Don't get me wrong, but he just is not. He's not a showboater,
Yeah.
So he's kind of just there. But his numbers and his stats are ridiculous, right? I mean, for a quarterback, all-time quarterback, I think he's number third. He's third ranked in a couple categories in all overall quarterback. But he got injured this weekend, and on his 150th game, which is kind of a bummer.
Oh, really? I didn't realize
Yeah,
that. That's
right. I didn't
crazy.
realize it either, and but yeah, so kind of a milestone game. That's a lot of NFL games, and
Yeah.
yeah, so and it's kind of the halfway mark. I mean, of the game for him, reps wise,
Mhm.
and to go out like that, especially after seeing what happened. So, anyways, let's go ahead and talk about the injury.
Yeah, so with torn Achilles tendon, that's what they feared when he was taken off the field. That was kind of this early speculation, and just to touch base on that, even without imaging, certain conditions you can do orthopedic tests and have a high degree of certainty of like, this isn't great. Like for the ACL, you can do like a anterior
Or
femur test, and if that thing's given a lot, you can have a high degree of certainty that the stability or the integrity of that ACL is now shot. And likewise, there's an analogous orthopedic test for the Achilles. And so, I feel fairly confident in saying that before that game was over, they knew that his season was over.
Yeah,
And
that test real quick for people. You basically squeeze the calf with them laying on their stomach. I mean, it doesn't have to be, but typically we do it laying on your stomach. You bend the knee and you squeeze the calf. When you squeeze the calf, the foot should flex or point. And if you've ever seen a tear, you get no movement in there. And you always test both sides, but usually the athlete's face down. You squeeze it. One, it's kind of painful, but
yeah,
two, there's no movement, and you kind of look around the room and everybody's head just goes down and just knows it's just a
yeah.
bummer. I've done
Yeah,
it
you're
a few
hoping for
times.
some flexion, right? You're like,
Yeah.
okay, it's not completely torn. There's some, you're just
That's be
hoping for something.
yeah. That's because, like you mentioned earlier, the anchor point, right?
Yeah.
The attachment is no longer there. So you squeeze and you put motion in it on a passive way instead of having them actively contract it, because they can actively kind of point it with a
Hmm.
lot of pain, but that's because other muscles kick in to help with that. So when you passively take it out, and meaning no movement on their part, you do the motion, you kind of contract it manually with your hands, and you get no movement. That's because there's no attachment site, and
Yeah.
that's a bummer.
Yeah, it's terrible, man. I mean, it's season ending at this point. We're midway through the football season. We talked about that before. The timing of injury really matters. Um, Aaron Rodgers, week one, tore his Achilles, and we've been talking about how he's trying to make a miraculous comeback and perhaps play 5 months post Achilles surgery, which would be unprecedented.
Yeah.
With Kirk, he's halfway through the season. There's zero possibility of him coming back, even if the
Yeah.
Vikings made the Super Bowl. So his season's a wrap. He's switched it to rehab mode. I'm not sure if he's had surgery yet as of today, Wednesday, a couple days past the date, but I'm sure he'll have surgical intervention soon, and then he'll be on the road to recovery. I'm going to do a little research on the type of surgery he had, and maybe next week we can compare what Aaron Rodgers had with what Kirk Cousins had.
Yeah, that sounds good. And unfortunately, you got two quarterbacks in the same year, two great quarterbacks, and now it's going to be a race to recovery.
Yeah.
Obviously, Rogers is going to win that race, but it's going to be a comparison constantly. That's what the media will do. And
Yeah.
if they're, but there's so many more variables into the recovery. So I hope they don't get caught up in like, well, he's doing this at this point. Why isn't he doing this? Or, it's just unfortunate, but that's typically there are going to be a lot of comparisons just because it's two quarterbacks, two Achilles injuries, right?
Yep.
But it could be different degrees, different recovery, different ages, different, so many variables,
All
different.
those factors matter,
Yeah.
man. Yeah.
So I'm hoping one thing. I'm hoping that his team, Cousins' team, has hyperbarics involved with that. I'm telling you, it's a game changer for that.
Yeah.
And PMF, those two, and I know Rogers is doing that. So
I was gonna say, I think uh knowing somebody who knows Aaron, and just from his reported, uh what's the word I'm looking for, interest in preventative care and the things that he does to take care of his body over the last decade, that's been documented and discussed. But like you mentioned with Kirk Cousins, most recently on this Netflix documentary, he really allowed people to see his routine and his medical care and the things that he does. So that was nice to kind of get a little bit of insight to what he does. It sounds like they both have a team with him that are going to do all the things that would help,
yes,
and I say that because not every athlete has a team around them that knows uh, a couple of extra things to do that could be helpful.
right.
I don't think every player in the league is using PEMF. I don't think every player in the league is interested or has used hyperbarics. There's a lot of things that honestly every elite athlete should be doing in the off season and during the season to keep themselves right. But we haven't reached that level yet. And yeah, I think as years go on and things become more public and people have more success recovering from injuries, people will start to mimic and copy all these great things, whether it's, you know, like I said, PEMF, or whether it's using an ARP wave, all these other modalities. I'll sometimes say that sports medicine, when I went to school, was still caught in the 1980s. We still use ultrasound, we still use e-stem, and that had been used for decades. But now it's 2023, and there's other modalities, other um, improvements in sports medicine, and so yeah, it'd be great if all professional athletes kind of get on this trend of prevention versus treating post injury.
Yes, I agree. Well, like you said, I think you start seeing a snowball effect of seeing, okay, what did he do? How was that outcome? I mean, that's what we saw in Rogers. He sought out, who was the athlete that we knew that tore their Achilles and was able to come back? That was Kobe. Okay, well, what did Kobe do? And so
Mm-hmm.
that's what Aaron did. He said, okay, well, if Kobe got back and we saw it was true and tested, then let me go do at least mimic as much as I can. So he got the surgeon, right? So then you'll see that trickle effect, and then it starts changing that. So we're hoping, right? We're
Yeah,
hoping people, you know, go. So
yeah,
it'll be interesting what you find out with, who did cousin surgery and what kind of surgery it was, and and then we get to talk about that.
yeah. We'll do a little compare and contrast. Switching gears, I want to talk about three other quarterbacks. Ryan Tannehill, he's recovering from an ankle injury, quarterback for the Titans. Last week, he didn't play due to the ankle injury. Rookie Will Levis stepped in. Man, this rookie came in, Dustin. He threw 4 touchdowns last week and
Yeah, I saw that. That was awesome.
really
Good for
balled
him.
out. Good for
Yeah.
him, man. It's nice to see. It's
Yeah.
nice to see young athletes have success in a very difficult league, especially at that position. Ryan Tannehill is expected to return in a week or two. It's nothing that is super significant. They just classify it as kind of an ankle injury, not even a high ankle injury, as I understand. And so, another quarterback, obviously, that position is very susceptible to injury. Um, just to name a couple others, the Steelers quarterback, Kenny Pickett. I don't know if you saw, he had a rib issue, a rib injury this last week.
Yeah, I didn't see that. I read it, but I didn't see it. So I didn't see it. I don't know if it was that one I was reading. I think one of the ones I read with the quarterback, it was probably him. All the report said was had a big defensive lineman land on him. It was
That's
funny.
enough. Yeah,
Yeah, it was funny how they described it though. It was like, oh
yeah,
man, that's enough. You get 350 pounds landing on you. That'll do it to anybody.
yeah. You know, I had somebody ask me this week, what is the most dangerous position in football? Like who gets injured the most? And it's instinctually, my answer right away was quarterback.
Mm.
And then I paused on it when I was driving home and was like, well, maybe it's not quarter. Maybe it's, an offensive lineman who's taken a bunch of hits. But this week we have a lot of quarterbacks. We talked about Kirk Cousins and his Achilles, Ryan Tannehill and his ankle, Kenny Pickett and his ribs, like you said, had a D lineman fall on him. That's a very accurate description and very
Yeah.
appropriate way to, for somebody to get hurt that way. Anthony Richardson, we haven't talked about him in a few weeks, quarterback for the Colts. He was out with an AC joint sprain, and it seemed like it was just going to be a couple weeks and he'd be back. We discussed kind of healing times and conservative methods of care. Well, he had surgery on his right shoulder this last week, and I just wanted to get your opinion. When you start off with an injury like that, Dustin, with an AC sprain, initially you're like, well, let's rest it, let's heal it, and you should be good to go. From a team perspective, having been on that side, you start down that road and then you switch gears and you say, oh, you have to have surgery. What do you think that they saw? Was it lack of improvement, or do you think that internally they discovered more damage, or why would you switch from, hey, let's see if we can rehab this, to now you're going to have surgery and now you have an extended period of being away?
I think once the inflammation dropped and the pain improved and he could start moving it around, and typically when you shift gears is because even though you drop the inflammation and now I have more function of it, I have I don't have pain-free function, and there's a lot more instability than we thought.
Mm-hmm.
So it's because initially when it swells up, the inflammation will cause instability, but then you're saying, okay, well, it's unstable because the inflammation's there. Let's drop the inflammation and the stability should come back. Well, if you drop the inflammation and the stability is still not there and the integrity of that joint is lost, then you have to start strengthening those muscles around it. But if it's too painful and it's too unstable, then you got to take other measures to secure it. And so they probably balanced everything out and said, okay, if we do surgery now, this is how your timeline is. If we wait and strengthen it, you're going to be a little better, but it's still going to hurt and be unstable. And so we might as well do the surgery now, get it a sure thing, and then get you back for next year.
Yeah, no, I agree. I think you could rehab it, go 3 months down the road, 2 months down the road, and still not be at 100%, and then decide, well, now we have to have surgery. So sometimes you're kind of, hedging your bet of, let's just do it now. We know this is going to be the most secure thing, even though it's a longer road to recovery. It's not going to be 2 months down the road. Now we have to make this decision, and now we have a setback.
Yeah, because when you're trying to play through it, the frustration level's out the door. It's just
Sure.
so frustrating to suit up every single day to then have the same outcome where it still hurts, still not, and this is an injury where it's not just hurt that you can play through, it's because it's damaged.
Yeah.
So, and you're like, no matter what I do, it's not getting better. We taped it, we braced it. It's not, it hurts. And, so then they say, okay, well, we shut you down and we go in and, fix
Repair
it.
it.
Yeah.
Yeah. Yeah. Lastly, one other quarterback, not to keep harping on the position, but quarterback Daniel Jones, I thought was interesting because he is now medically cleared. He had several weeks where he had a neck injury, and we were kind of speculating, is it like a compression issue? Is it a whiplash issue? And they weren't really super specific with it. They kind of kept it close to the vest, but he's been cleared, which tells me, one, that structurally things are healed or at least stable, and that they're confident enough that he's not going to make that injury worse. This is not an ankle, it's a neck. So I think you take a little more care and precaution before you clear somebody. But it'll be good to see him back on the field. I know it's been a few weeks. the Giants have struggled without their starting quarterback, even though their backup Tyrod Taylor, I think, could be a starting quarterback in the league as well.
Yeah, yeah, I think you're right. I think that they get his range of motion back as much as he can. He's probably got full range. They do the compression test. There's no radicular issues. There's nothing that they can see why he shouldn't play. So regardless of how he feels, right? So you might feel one way, but all the tests, all the imaging, everything pans out as structurally and mechanically healthy. Then you get the clear to go, and then they start seeing how he feels or how
Yeah.
he moves. So yeah, so that's good news for him. Obviously they're not going to put him out there at risk. Like we said last time, if he's got a banged up neck and he can't move well, and then he takes a hit and lands on the turf, that's more susceptible to concussion. So they're not going to put him at jeopardy for that. So they're going to make sure the mobility's there. So if he does get whipped around, he's fine.
Yeah.
So that's good news. Talking about quarterbacks and with your Niners, seeing what Purdy, so I think he had, and correct me if I'm wrong, but something like 15 straight games without an interception or something like that since last year, right? Since 2022, he hadn't had an interception. And then in the last like 2 or 3, he's had 5 interceptions,
Yeah.
or something like that. The numbers are close to that. So I start thinking, okay, what's different? It's not his game, it's not his mechanics, but what I'm feeling is that, so he was in concussion protocol last week and because he was having a headache on the airplane and
Yeah.
having issues. They did the concussion protocol. He cleared it the day before or the day of. Was able to the day before he was able to play, but
Which
I
was
believe
accelerated, by the way.
what's a
For me, that was accelerated, by the way.
yeah, yeah,
Usually when you're in concussion protocol, I don't know what the stats are, but most people don't play the following week. It's usually you sit a week, and with a bye week coming up, I really thought they were going to sit him, especially with their competent backup and Sam Darnold.
yeah,
And yeah, I think you're right on. I think some of those, it's hard. I've had many concussions before, you have as well. And cognitively, you do have a deficit that lasts for a while. And you can pass all the things. We've talked about it before, all the screening and all the hoops you have to jump through to get that green light. But I think you had mentioned in a previous thing, just because you can do something doesn't mean you should do something.
mm-hmm.
And this seemed like a perfect issue. In fact, in one of his sacks, he got knocked back, and again he had a Tua type where he hit the turf, shoulders hit, and his head went and whipped back. And I mean, I saw his grimace, and I was like, man, that's not good coming off a concussion. He just had another dinger. So it's hard to attribute 100% to that, but he didn't seem 100% right to me.
Right, and I tried to do a deep dive into, like, because there's certain websites that have like all their history of medical stuff
Mm-hmm.
to see the lineage of concussions or head traumas he had. There was nothing reported, but I would bet that if we went back probably 4 or 5 weeks ago, he had some issues that were not reported, or he might not have even said anything. Just had a normal headache after a game, which
Sure.
is we know is not normal. Like, I mean, it's become the norm, but it's not good,
Yeah.
right? So, and then you see this slow decline of his play, and the bummer part is for the normal spectator, they just think, oh, he sucks now, he can't get it done. But you got to understand, when your synapses and the messages from your brain to your muscles are slower or being interrupted, or you tracking a receiver or whatever is off just slightly, like static on a radio or
Yeah.
static on a TV, the message is not as clear, right? So it makes it very hard to do what you have to do as a quarterback. So I just feel bad for him, because obviously they're going to pull him and go a different direction. I'm pretty sure, I think I read that.
Well, they have a bye week coming up this week, so
Yeah.
maybe with the bye week, he won't miss time. I haven't read the latest on it, so if it's significant enough that they're thinking he might not play after the bye week, that to me is kind of a mess up to have him play the week before the bye week when he was iffy.
Yeah.
He could have just rested and been 100% sure. I mean, look, with the concussions in the quarterback position, there's a couple key things, right? It's not only decision making, but it's reaction time. And so, yeah, you might be able to have the velocity in your arm, but to be able to process what's going on when everything is split second, it is so fast. I'm telling you, watching a game on TV, and watching it in the stands, different. Watching it in the stands and being on the sidelines, completely different. It is a whole nother speed. And so I think about the reaction time and the decision making, both those, if they're just a millisecond lagged, that's the difference between making a proper read and not making a read. And I know your vision's affected. It just seemed like some of those mistakes he made weren't typical of his average play. So
Right.
if I'm speculating, I think he was affected by that head trauma, and it looked like he kind of got dinged up again on one of those plays. So I'm hoping he's okay. You know, that's a half a dozen quarterbacks we named between Kirk Cousins, Ryan Tannehill, Kenny Pickett,
Yeah.
Anthony Richardson, Daniel Jones, Brock Purdy. Like,
That's a lot of,
that's a lot.
yeah. Real quick, last one I want to talk about though, because I saw this kind of interesting. So we talked about this in a podcast, how hard it is to change positions and change, and why it's hard to do that sometimes because of the muscle
Yep.
memory and stuff like this. Well, the Jets center got injured. His name's Connor McGovern, got
Okay.
injured, went out with a knee. So they took the left guard and slid him over, and so he moved over a position, which was, I did some research on it, and his name's Wes Schwitzler or Schweitzer. So I hope I didn't butcher it too bad. But anyways, he was playing right guard, then moved over to left the last couple weeks, so switching sides, right? And then he had to move left to right again to center in the game, and he got injured in the same game with a calf. So I tried to find which calf, if it made sense, with snapping or whatever, but it just goes to show it's not easy to do. You would think, oh, well, it's lineman, whatever, you should be able to do both sides, whatever. But when your body's ingrained in the same repetition,
Yeah.
it's just like if you're always rotating to the one side to catch a ball, left side, left side, left side, and then all of a sudden have to go right, you'll feel something different. You'll strain something a little different, easier. So anyways, I felt bad. So two main offensive linemen for that's rough for a team, to go down in the same game. So,
Yeah,
but
that is, you're right about, there's muscle memory there, and there's, hardening, I'll call it, of tissue. You get used to kind of moving in one fashion, and then if you're doing something totally opposite, that could compromise you.
yeah. So just interesting from a
Yeah.
sports medicine standpoint to see how that happens.
I'd like to end on a high note here. Well, two things. One, the Niners have lost 3 in a row. So coming off this, going back to Brock Purdy, I'll be curious to see how that game after the bye week this week that they have, how they perform and how they respond, how Purdy plays post concussion, and how the team responds after 3 losses in a row. So that's something I'm interested in looking at. On a high note, for the first time, I think this season, I came across something that is unprecedented for us, and that is there were 2 teams that reported no injuries this week. And I haven't seen that before. Maybe there's been other teams that haven't reported things, but the Cowboys and the Eagles both reported no injuries this week from last week's games. And so I was happy as I was scrolling down the team. Every team has a list of injuries, and they were the only ones that didn't. I said, damn, that is cool. That'd be amazing if we had more of those every week,
Yeah, that's nice. And then the skeptic in me, the sports medicine guy in me, says, well, they just didn't report them.
Right.
Right.
That's
No,
actually the truth. Yeah.
right. No, you hope that's true. And that is that, because they're held to a very strict reporting guideline.
Yeah.
And so they have to report things. So, and then it's like there's a list of what do we actually have to report. And so if everything flew under that radar where it wasn't significant enough, that's awesome.
Yeah.
That's good for them. So
No, it's cool.
that's awesome. Yeah, I don't know the last time that's happened.
It's been a while. I
Then to
can't
have
recall
2.
either. Hopefully next week we have a couple more.
Yeah, let's keep that going.
Well, I'm gonna let
Hats off to the sports medicine team, by the way, on both those teams.
honestly,
Right?
yeah, they're doing something right, keeping them patched together, and that's probably a good feeling when you hand in that paper and it's blank.
Well, I know the teams I've worked on, a couple of the trainers, that was a big stat at the end of the year. We would look at that, how many injuries were reported, and then
Mhm.
in the beginning of the next season, we would bring that up and say, okay, we got where can we improve? What do we need? Because we want to keep those numbers down. So
Sure.
just like the athletes and the team keep their stats, the sports medicine team keeps really good stats on all that too. So it is a pride thing, and all those trainers get together for an annual conference, and you kind of want to have, everybody knows where you kind of stand, so you kind of want to have those good numbers. So
Absolutely. No, that was good. Well, it was good talking today, Dustin. I'm glad we chopped up a couple issues, talked about tennis elbow, talked about the contrast between golfer's elbow, covered a lot of these quarterbacks that were injured, um, and some patient cases. So I appreciate the time today. We'll catch up again next week. Is there any last thoughts you have?
let's see. No, what is it? It's today Wednesday.
Wednesday,
Yeah,
November 1st,
Wednesday.
I believe.
All
Yeah.
right. Yeah, that's right. Well, yeah, let's get through this week and have a good one and move forward.
Yeah, I'm looking to have an amazing month. I hope you do as well, and I hope our listeners do too. I like the start of months, the start of years. It feels fresh and a time to improve on habits or add new positive habits. And so, hopefully, everybody out there is staying healthy and will have a good week. I'm a month from my birthday, so I'm trying
Oh
to
man.
make a 30-day push so I,
Oh, all right.
look good, feel good, and
Play good,
all,
right?
all the things and play good. Yeah, yeah,
Well, I
exactly.
like your sweatshirt. I told you before we started, man, that's a good one.
Thanks.
Yeah. So
Yeah, if you're going to be a G, you might as well be a spiritual G.
you're good at that, man. So I appreciate you for that.
For sure. Likewise, likewise. Well, we'll talk during the week, Dustin, I'm sure. Have a good day at work, man. Do what you do out there, and we'll touch base soon. To our listeners, we thank you. Uh, you know, send this link to somebody that you care about if you found this episode interesting. We always like to expand our audience, and I've said it before, we do read the comments and appreciate it, and we will definitely integrate your suggestions into following episodes. This is Second Opinion. We're the Sports Medicine Podcast. I'm Dr. Dhokal,
I'm Dr. Glass.
and we're the Pro Sports Docs. We'll be back with you guys next week. Looking forward to it. Dustin, have a great day. Have a great start to the month, and we'll talk soon.
Sounds good, buddy. Have a good one.
All right, bud. Have a good morning. Bye
You
bye.
too.